The COVID-19 pandemic taught us to be more vigilant of airborne viruses than ever before. Airborne viruses have been a thing for many, many years, yet never before was it taken as seriously as it was during the pandemic. It became absolutely imperative to avoid any and all possible sources of contracting the airborne disease, but for some people, this simply wasn't possible. Doctors and other healthcare workers have been in close proximity to airborne viruses for many, many years, even before the pandemic. They have had to treat patients with the most contagious of viruses up close and personal, putting themselves at constant risk. Now, obviously, they wear masks and other protective equipment to minimize their chances of getting sick, but with airborne viruses, sometimes there's no way to avoid them and provide proper care. Well, that may not be the case anymore, as new antivirus air curtain systems may be the future for healthcare. The creators of the technology have called it the Desktop Air Curtain System, or DACS for short. It can be broken down into two different parts. One part is the air curtain component. The other part is the virus inactivation technology. Starting with the air curtain, it essentially creates a wall, or curtain if you will, of air between the patient and the healthcare professional, and it prevents aerosol particles from passing through and contacting the person on the other side. Air curtain technology in of itself is not new. In hospitals, air curtains are used in the OR room to keep a sterile environment. But these air curtain units have a different purpose than that of the DACS. Traditional air curtains are meant for separating inside and outside environments and are fixed in one room. The air curtains of the DACS are meant to prevent spread of disease during face-to-face interaction with patients, something that air curtain technology has not been used for before. They can also be transported from room to room due to their portability. There have been attempts at a portable air curtain system in the past. They were effective in terms of protection. However, because of their design, the air curtain would lose its intensity over time and create a turbulent flow, which would result in aerosol particles being dispersed all around the room, rendering the device useless. The DACS was designed with this in mind and has a generator at the top of the device which pushes air and aerosol particles down into a suction port at the bottom, which collects the aerosol particles and prevents any dispersion of particles. Another great benefit of the DACS is that normally, getting close to an infectious patient to collect blood or other actions that require physical touch can increase the risk of transmission. With the DACS, patients can put their hands through the window of the DACS without compromising the air current's effectiveness, which allows healthcare professionals to perform tasks like drawing blood and administering needles with little to no risk to the healthcare professional. Alongside the air curtain component, researchers at Nagoya University also created a virus inactivation unit, which can inactivate viruses and works in tandem with the DACS. It attaches right to the suction unit of the DACS and inactivates viruses that enter the suction unit. It was specifically made to inactivate the SARS-CoV-2 strain of COVID. However, it can be fine-tuned for other viruses as well. Inside the box is a single path for the air carrying the virus. The path is separated into multiple levels, and the virus moves down the path until it reaches the end. Along the sides of the box are deep ultraviolet LED lights. These lights emit a certain wavelength of deep ultraviolet light that can inactivate the virus. By the time the virus reaches the end of the path and is released, it is 99.9% inactivated. When a virus is inactivated, it obstructs the virus's ability to replicate and infect its host, meaning even if someone comes into contact with the inactivated virus, they won't get affected. Additionally, you can add an air filter to the unit, which will clean out the air of other particulates that were collected in the suction port, removing the need of constant maintenance and cleaning of the air curtain. The portableness of the DACS alongside the effectiveness of the virus inactivation unit provides the technology with lots of potential for its application. In a hospital setting, hospitals could purchase multiple units and have them set up on a cart, allowing them to act as a mobile virus prevention unit. Doctors or nurses could then take it with them from patient to patient, preventing the spread of infectious diseases to themselves and to others. The portableness of the DACS allows it to be extremely beneficial even outside of a hospital setting. Healthcare workers could take the unit with them on house visits, allowing them to stay safe while also providing care to those who have contracted infectious diseases and cannot make it to a hospital. While the technology was designed to prevent the spread of COVID-19 in hospitals among staff, the researchers have also highlighted the other potential uses of their technology. They believe that the technology can be highly effective in areas that require face-to-face interactions or where safe physical distance cannot be obtained. One such example would be a receptionist position. One of the best potential uses for the technology would be a cashier, where they can serve over 100 customers per day, putting them at a much higher risk to get sick, especially during a pandemic. Airports could also benefit from the technology, specifically check-ins, as there are tons of people flying in and out every day. Banks also see quite a lot of people daily, and meetings can sometimes be very long, in which case there's a much higher chance of transmitting disease. The DAX would also protect pharmacists from getting sick via over-the-counter interactions with an infectious individual. These are only a few potential implementations, but the potential places where the tech could be used are truly vast and endless. The tech does have some limitations. Currently, there is no public information on the pricing of the DAX, which could affect how widely the tech can be implemented. Another limitation of the tech is that currently, the arm sits a little too high due to the height of the suction port, which can affect blood collection procedures. The researchers have acknowledged this and are looking into lowering the suction port so that the arm sits below the heart when rested on top of the suction port. The desktop air circulation system and its accompanying virus inactivation unit are extremely valuable tech that holds lots of potential and promise for not only healthcare, but other industries as well. This cutting-edge technology transforms the way we go about protecting ourselves against airborne viruses, which, as we learned with COVID-19, can be extremely dangerous on a global scale. With this technology, healthcare professionals can treat infectious individuals with less risk to their own health, allowing them to provide patients with the best care possible, with potential of expanding to other industries and providing a safe environment for all.